What is a G-tube? What's in the G-tube packet? So you got two different types of G-tubes here. A regular type from a Medline and a silicone type G-tube. Pretty much they function the same. They are inserted directly to the stomach. Has a balloon, a feeding, and the medication port. The difference is a packet has the G-tube and lubricant in it and has directions in it also. So when you open it up, pretty much you have this standard G-tube in there, and then this is the 24 French. Pretty much the G-tube brings nutrition directly to the stomach, easy medication insertions to the stomach. Usually it's for kids or patients who are having trouble eating and need supplemental nutrition. Pretty much your standard size, length. The difference, as you can see here, is just the silicone see-through type, and then this is just the regular old style. As your lubricant that you use, so you can apply it directly inside the stomach, easier access, just directions on how to remove a G-tube, replacement of the tube, irrigating, inspecting of the stoma, the maintenance of it. Simple basic instructions that come with it, pretty much for quick read. G-tubes can initially last for 12 months. Recommended changing is about 3 to 6 months overall all time. So your port right there can be for feeding, and right here can be for medications. The only thing I don't like about this one, it doesn't really label it, where it says balloon, feeding, and medication port, and it's a little struggle of like trying to close it back up. As far as the opening, it's pretty big, so when the balloon inflates for the water, the normal saline, there's pretty much a good amount of room for the medications to pass through without getting clogged easily. It stretches well, so even if it's tugged and pulled, it won't really rip. It's pretty durable. It has a pretty much good function on top of it. As far as the silicone one, as you can see, it's see-through. Opening it is pretty big. Pretty much the same size as the other one, the white one in the video. So here's your feeding port. It closes up nicely, and then opening, it's pretty securely tight, so it doesn't really pop open. There's really no fluctuations or any difficulty in it. It's labeled balloon, feeding, and medications as the top one, as you don't really see it. And the opening and closing is pretty much differently. It seems like the white one can pop off easier and leak a little more. These ones stretch a little longer, and they're not really resistant as much. Sliding that port is pretty easy. There's not much difference to it. Pretty much the same. It does the same function, just different companies. Overall, that's the difference between these two G-tubes and the functionality of them. That's all I have for you guys today. Peace.